Hello everyone, welcome back to my channel. If you're new here, I'm Dr. Fen, and on this channel we break down complex medical topics to keep you informed and healthy. You may have heard of fatty liver disease. You or someone you love might be having it. In the United States, 1 in 4 adults have fatty liver disease. The same goes for most other countries. What most people don't understand is that fatty liver disease is a condition which can progress to liver cancer. Today we will see how it happens, what are the warning signs of liver cancer, how can you detect it early, and what the treatment options are. Let's get started. So what does our liver do? Liver filters and removes the bad things from the blood, helps in the digestion of food, and stores many vitamins and minerals for later use. There are 3 things that can damage your liver and cause cancer. The first one is fatty liver disease. When you have food and drinks which are high in calories, the excess calories get stored in the liver. The risk is higher if you're overweight or have diabetes. When the unhealthy lifestyle continues for a long time, the liver cells get irritated or inflamed. Many liver cells die and the liver gets scarred, causing liver cirrhosis. And cirrhosis can progress to liver cancer. The solution is controlling your diet and being physically active. Next is alcohol. Just how excess fat causes the irritation of liver cells, alcohol can cause alcoholic hepatitis. When heavy drinking is continued for many years, it can cause cirrhosis and liver cancer. Drinking, even in moderate amounts, is unhealthy. The best solution is to avoid alcohol. Now you can imagine how risky a combination of an unhealthy diet and alcohol can be. That is like a double attack on your poor liver. The third are viral infections like hepatitis B and C. You can get these from blood transfusions without proper precautions, unsafe needle and sexual practices. Hepatitis B is preventable by vaccination, and if you have not been vaccinated yet, please consider that. There are many other causes for liver cancer, but these are the most important ones. Detecting liver cancer in the early stage is very difficult as most patients may not have any symptoms. These are the common symptoms that patients generally complain of. Fatigue. You might just feel weak and tired. Vague pain. You may have pain in the right side of your tummy where the liver sits. Loss of appetite. You may not feel hungry. You feel full even after a small meal and feel like vomiting. Unintentional weight loss. You may lose weight without wanting to. Remember, these signs can come from many other problems. They don't always mean cancer. So if you are experiencing any of that, please do not panic but get yourself checked. As the cancer grows, more serious symptoms start to appear. You may develop jaundice, that is yellowing of your eyes, skin and urine. Ascites or fluid in your belly. The pain can become worse as the cancer grows. Now we will see what tests are done if your doctor suspects a liver cancer. First would be an ultrasound scan. It is quick and painless. It will give us an idea if there is something to worry or not. Next would be blood tests called alpha-fetoprotein and PIVCA. These are tumor markers that may go up in some patients with liver cancer. If these tests show that there is a problem, next would be a CT scan or an MRI scan. These scans can show the liver and the cancer more clearly. A biopsy is not always necessary. It may be done for some patients if things are not very clear on the scan. Now let us discuss what the doctors can do when a liver cancer is diagnosed. The treatment depends on the stage of the disease. In the early stage, the cancer is small and confined to the liver. There are 3 options. The surgeon can remove the cancer if it is very small. If surgery is not possible, we can do a procedure called microwave or radiofrequency ablation, where the tumor is destroyed using high heat. If there are many tumors or if the remaining liver is damaged, a liver transplantation can be done, where the bad liver is replaced with a healthy one. Now imagine if the tumor is much larger but it is still located within the liver. This is called an intermediate stage. For these patients, there is a treatment option called embolization. The blood vessel that feeds the cancer is blocked, so the cancer cells starve without food and die. In the advanced stage, the cancer has spread beyond the liver and gone to other organs. At this point, cure is generally not possible. Treatment is mainly done to slow down the growth of the cancer. Targeted therapy and immunotherapy are generally used at this stage. Chemotherapy is not very useful. These medicines can improve the pain and the tiredness and help the patients live longer. Let us summarize the key points. The main risk factors for liver cancer include fatty liver disease, excessive alcohol intake, hepatitis B and C infections, which can lead to cirrhosis and liver cancer. Early stage liver cancer is hard to diagnose. The usual symptoms are fatigue, mild pain, loss of appetite, and weight loss. Advanced liver cancer can cause jaundice, fluid in the belly, and severe pain. Tests for diagnosis include ultrasound scan and blood tests like AFP and PIVCA. This is followed by CT or MRI scans for confirmation. Biopsy is done only if needed. Treatment depends on the stage. Surgery, ablation, or liver transplantation is done for early cases. Embolization for intermediate tumors, and targeted or immunotherapy for advanced cases to slow down disease progression. That brings us to the end of the video. Thank you so much for your time. If you like the video, please share it with your family and friends. If you are new to our channel, please check out my other videos and subscribe to the channel. We will meet again with another interesting topic. Until then, take care.